Hello everyone. Alright, so my client is a 27-year-old male who is married with a young daughter. He is a veteran of the U.S. military, and he served overseas in Afghanistan and Iraq. He has been home for about a year now. During his time in the service, he has had multiple deployments in combat zones, and he was part of a unit that experienced some of the most intense fighting and loss. Since returning home, his wife has complained that he has been distant and emotionally numb to her and their daughter. He has also expressed her concern with how much he is drinking and spending time at the bar. It worries her that he never talks about his deployments or even the military at all. Worried he was becoming so closed off and that he was obviously suffering, she encouraged him to seek help. Originally, he wasn't very open to the idea. This changed after he was arrested for starting a fight in one of his regular bars. After this event, he realized he would lose his family if he continued down this same path. The incident my client was arrested for at the bar happened when he was highly intoxicated. A group of guys were sitting at the table behind him, laughing and telling jokes. One guy in that group slapped the top of the table in response to a joke. The noise was very loud and unexpected. Startled, my client jumped out of his chair and engaged the guys behind him. The police were called, and my client was arrested and charged with assault because the fight seemed unprovoked. On one of his deployments, his unit was stationed at a remote outpost. This unit was ambushed, and after a few days of intense fighting, he was one of the few survivors to make it through the siege. Ever since, he has been suffering from recurrent and intrusive, distressing recollections, including thoughts, images, and perceptions. He also occasionally has flashbacks and hallucinations, especially when he gets highly intoxicated. When I asked him about his sleeping patterns, he acknowledged that he has trouble falling asleep and rarely, if ever, sleeps through the night. He also reported having recurrent disturbing dreams. He used to enjoy his 4x4 vehicle hobbies, but is no longer interested. When I asked him about this, he admits this is partially an avoidance to the smell of gas and oil. These bring on feelings of nausea and increase feelings of anxiety. He recognizes he has felt emotionally distant from his wife and is worried about losing his family and their future ambitions together. Because of the trauma history and his symptomology, I believe the client could be diagnosed with post-traumatic stress disorder, PTSD. I base this diagnosis on the criteria established in the DSM-IV. My client was exposed to life-threatening trauma. He suffers from recurrent and intrusive recollections of the event, along with occasional hallucinations and flashback episodes. He is clearly engaging in avoidant behaviors and has feelings of detachment and restricted affect, as well as diminished interest in activities he previously enjoyed. He has been having sleep difficulties and acts with exaggerated startled response. These symptoms have been occurring for about a year now and are affecting his relationship with his wife and family. Establishing a strong, trusting relationship will be a key for this therapy to be effective, especially because he is currently hesitant and anxious about psychiatric therapy. A major challenge will be the client's substance abuse. It is essential that he be sober during the therapeutic sessions. If he is not, it is understood that the session will be called off. A major strength for this client is his support from his wife, daughter, and mother who lives in town. He is motivated to stick with the treatment in order to avoid losing or damaging these relationships. Because he is so deeply engaged in avoidant behaviors, hesitant to discuss his traumatic experiences, and anxious about starting therapy, I am concerned that he is at a high risk of dropping out, especially in the early stages of treatment. I would propose that my client begin treatment sessions with mindfulness-based stress reduction training, MBSR. Utilizing this training first could help my client by providing him with some skills that could help to manage the distress, anxiety, and emotional states encountered during exposure therapies. MBSR uses experiential exercises like the body scan to bring non-judgmental attention to present moment experiences and thoughts. This therapy could help the client to recognize patterns of thought in a curious and non-judgmental manner, which could help my client to recognize and disengage from ruminative cycles of thought. MBSR could be considered a type of exposure therapy because this non-judgment and curiosity are applied to cognitive, emotional, and physical experiences. This includes those experiences that can be difficult, like intrusive thoughts and images stemming from the trauma itself. This mindfulness practice provides instructions for treating thoughts as passing mental events, and that these thoughts shouldn't be avoided or suppressed. My hope is that this training would allow my client to begin to reprocess the past trauma in a safe, non-judgmental environment. MBSR could also potentially decrease the risk of dropout for this client. Homework for this therapy would include going through a daily guided practice in mindfulness meditation using a provided CD. An alternative therapy shown to be effective with PTSD is cognitive behavioral therapy, CBT. This treatment involves reducing the level of distress associated with memories of the event, resulting in physiological reactions. Research on this type of therapy has suggested it is necessary for the client to reconstruct and elaborate on what happened during the traumatic events. A central element to this treatment is cognitively restructuring reactions to the intrusive memories and images. Exposure through the recounting of these experiences, combined with the processing of the thoughts and beliefs brought on by these experiences, could also reduce symptom severity and recurring thought processes. For homework, I would ask the client to construct a narrative of the traumatic events using elements of the cognitive restructuring to give new or different perspectives to the events. Hopefully, this will help to decrease the physiological responses to these memories. Another element of the homework would be to ask my client to identify possible triggers encountered throughout his day, and then to record his reactions to them. I believe both these therapeutic techniques could be useful for this client based on his symptoms and goals for treatment. As I previously mentioned, I would recommend MBSR as the initial treatment method. Because exposure to traumatic events is unpleasant at best, reducing a client's risk for initial attrition is important. I believe MBSR will provide my clients with tools with which to handle the distress from exposure early in the therapeutic process. Thank you.